Hello, my name is Professor Tom Hazel. I'm one of the NCLEX coaches, and this PowerPoint that you're about to watch is the first in a series that we have created, and this is going to center around an introduction to the NCLEX. Go over some frequently asked questions, talks about exactly what the test is, what you should expect to see on it, and then we'll go over some sample questions of topics that you will see while you're sitting for the NCLEX. So, what exactly is the NCLEX? The NCLEX, also known as the National Council Licensure Examination, it's a standardized test that every state regulatory board uses to determine if a candidate is ready to become licensed as an entry-level nurse. Before you can register to take the NCLEX, you must first apply for a license through your state's Board of Nursing. To do so, you must meet the accreditation requirements for the license you seek. A registered nurse must have at least an accredited associate's degree in nursing. So basically, you go to nursing school. Once you've applied for a license, you'll receive a candidate bulletin outlining the details for registering for the test. You'll do so through Pearson VUE, but you won't be able to schedule a time to take your test until your eligibility has been verified. So you'll apply. Pearson VUE will verify that you are indeed at least an associate's candidate to sit for the NCLEX, and then they will approve you from there. How do you become eligible to take it? You'll know you're eligible when you receive an authorization to test via email. That's an ATT. Your ATT will include a candidate number, validity dates, that's typically good for a period of 90 days, and a list of local testing centers. At this point, you can schedule a day and time to take the test. Testing is available year-round, almost every day of the week. What does it cost? Well, the cost is around $200, and I'll explain why I say around in a little bit. And Nightingale will reimburse. If you're successful in your first attempt, you will be reimbursed that $200. In most cases, you'll send the money along with your registration to take the test. Depending on where you live, your state's Board of Nursing may require additional fees for registration. That's why I said it's around $200. You may also be charged extra fees if you wish to make a change after you submitted your registration. Changing your regulatory body either to a board in a different state or a secondary board in your current state costs an additional $50. So what is it? What is the NCLEX? What is and how this webinar, what is this as it relates to the NCLEX? It's meant to be very practical information that will help you understand what the NCLEX is, along with tips on how to best approach it. And what this is not, this webinar is not meant to be a be-all, end-all. This is not meant for you to be able to watch this and say, okay, I'm good to go. I know everything I need to know about the NCLEX. This is an aid to help you prepare eventually to sit for the NCLEX. Okay, so specifically, this is a PowerPoint on an intro to the NCLEX, giving you information around what it is, what kind of questions you'll see, and some ideas on how to prepare for it. But the onus falls on you. As the learner, the onus falls on you to prepare, to study, to really dig deep into this stuff. If you really and truly want to be an RN, then there's a lot of hard work that goes along with that to get to that point. So I would encourage you to have very good study habits. Repetition is huge. Take and retake as many NCLEX style questions as you can. When you remediate those questions, when you look at the answers, make sure you understand why the rationales are correct. Don't just look at the rationale and go, oh my gosh, I can't believe I got that one wrong. Understand why that is the correct answer, because that is the heart of clinical judgment and or critical thinking. They're really two sides of the same coin. If there's anything you don't understand, please reach out, talk to one of us, the NCLEX coaches. I'll have contact info at the end of this PowerPoint presentation where you get a hold of us, or connect with your your professor, but make sure you dig deep into this. So let's go over the areas that you will be tested on. And these are set up in order from the most to the least. So management of care is the first 20%. That's um, the biggest section that you will see, those kinds of questions, those areas. So management of care rules. Here's some rules of thumb for management of care. Do not delegate functions of assessment, evaluation, and nursing judgment. You can't delegate those. Those can only be completed by you, the RN. Number two, delegate activities for stable clients with predictable outcomes. So you're not going to get an acute client who's post-op and it's got all kinds of major complications going on, comorbid. You're not going to delegate that. That is going to stay with you. Number three, delegate activities that involve standard, unchanging procedures. So vital signs, you can delegate those. You know, ask your nurse's aide, hey, can you go check the urine output on the patient down in 5B? Okay, stuff like that, stable clients. Number four, remember your priorities. When you're thinking about delegating, remember your priorities. Maslow, hierarchy of needs, your ABCs, stable versus unstable patients. Keep those in mind when you're thinking about delegating. Okay, next category at 15%, pharmacological and parenteral therapies. These will be questions directly related to meds, their side effects, and by side effects I mean expected versus unexpected, and regular expected outcomes. Blood and blood products, central venous access devices, dosage calc, medication administration, parenteral and intravenous therapies, pharmacological pain management, and TPN. So those fall under pharmacological and parenteral therapies. Physiological adaptation at 14%. These questions will center on fluid and electrolyte balance, alterations in body systems, hemodynamics, illness management, medical emergencies, pathophys, and unexpected response to therapies. Physiological adaptation. Your next category at 12% is safety and infection control. This area will cover advocating for the patient, keeping information confidential, making a discharge plan, maintaining a high quality of care. This category is a subcategory of management of care, but it is given its own, area, if you will, at 12%. And there are more of these. All right, 12%, reduction of risk potential at 12%. Nursing actions covered in this subcategory include changes, abnormalities in vital signs, diagnostic tests, lab values, potential for alterations in body systems, potential for complications of diagnostic tests / treatments and or procedures, potential for complications from surgical procedures and health alterations, and system-specific assessments, and then therapeutic procedures. So those all fall under reduction of risk potential at 12%. Then you have your psychosocial integrity or psych-social at 9%. And this is an area that I park on and I want to talk to you about a little bit. As an RN, this should be one of the most important areas that you develop. The reason being is that pretty much anybody can set up an IV pump with enough direction. So, an IV pump or Jackson Pratt or change a dressing, or those are things that you do as a nurse. But as a nurse, I want you to keep in mind, and I used to say this to my students that I would precept on the floor frequently, is that as a nurse, you want to keep in mind that if you are a patient in that bed, what kind of nurse would you want? And then I want you to be that nurse. So if you would want a nurse that ignored you, that never answered the call bell, that acted like you were a major pain to them, then be that nurse. But if you want a nurse that would be compassionate towards you, that would don't have any there. So psych social, huge area as a nurse that you want to develop. Okay. Um, so when you're talking about psychosocial integrity, you want to think about the background, those sort of things. So keep in mind, you'll be on areas around support systems, grief and loss. So those are the kind of questions, basic areas you will see. You will see these areas, and these are not all ending lists. These are a overview of the kinds of questions on the NCLEX. These will cover basic care and comfort, assisted devices, elimination, mobility, immobility, non-pharmacological comfort interventions, nutrition and oral hydration, personal hygiene, rest, and then our last area is health. And these are the areas you will see. Developmental stages and transitions. So when you're talking about developmental stages, you Piaget, but a lot of Erickson development, this versus that. Health and wellness, health promotion, prevention, health screening, high-risk behaviors, lifestyle choices, principles of teaching and learning, self-care, and techniques of physical and all. Some more details and facts about the NCLEX. And a CAT stands for Computer Adaptive Test, which means the exam decides question difficulty level based upon your NCLEX, and if you doesn't immediately, what it does is it will start I want to know this because I sat with the end question on an and um, excuse me on that. So what is the NCLEX testing? It's testing your clinical judgment. That is so critical thinking, clinical judgment are one and the same. It's testing your clinical judgment to determine if you are going to be a safe and effective nurse. Are you safe? What is, well, that's a question I hear a lot. It's what the NCLEX base you have thoughts above the entire NCLEX. And you have how many questions on the NCLEX? Well, just a little bit. You're going to get any at 7 safe, you pass. 65 because they below that line and tested for enough answered correctly proves that can be safe. See anywhere from 75 How long do you have to take? And you come in, anyway, just be a little insight into that. To 6 hours to take it. Collects one from you. So the single construct or point of each passing level question is to determine what's it wants to determine is critical thinking and clinical judgment, one and the same, provides safe to a client in any situation. The learner changing it, that's the question. Yeah, but at my facility, that's when you can then collect questions, if you answer that question wrong. What is the point? Well, before the point is, it's looking to see if you're safe to practice as an RN. Which action is the safest action to take? Which action will help the most to keep feel correct? You have what's in some of the your clinical judgment. They're not on that previous slide. How are the questions? Taxonomy is used in writing NCLEX questions, PowerPoint presentation, and we'll learn more about Bloom's taxonomy as we go. Before you are able to perform order thinking. So let's see. Categories. Multiple responses. Many. These will show you fill in the blanks. These are typically ordered. Fill in the blank. Ordered response. You will and correct. And those are you click on an exhibit button to display charts. Once you've done so, you from among four. You also have a list. And then you have options. And then you'll have graphs. So now we're going to go through some sample questions. And you will of reading, but I'll just on these. These are the sample questions that you have a child with and and to stay with a child contains phone. Or you ask the NEP, the child's place, which one, or ask the, that be the most important, that would be the only thing I could do. Ask the LPN. Well, I get this. Where you think, okay, I got it. There. Do I ask the LPN LVN to assess the peripheral pulse while I complete the the thing? So I'm going to, I could ask the LPN LVN to stay with the child and his parents while I get phone. Way to go. Am I going to ask the NAP to obtain equipment for the We've eliminated the ones, most of them, and I'm going to show you the correct answer. I'm going to ask, please go get the as the correct answer. All right, so we're going to move on to our next category. And here's a question. Perform the I into which of the following? For the step. Yeah. It all. So sorry, lost connectivity. So think about the dorsal surface of my and fly on the that's the surface I'm looking at. So I wrist just why would I all the time? I will tell you all. I don't know. Thinking, narrow it down to 3 and 4. And I'm thinking to me, okay, the hand on the non-dominant side, the hand moves off. Maybe, maybe, whereas the forearm is much more, not a lot of movement going on there, a lot more room to keep it down in several places. The survey would say forearm on the non useless. So moving on, next category. Adaptation. And here's the question. Nurse delivers while performing CPR. Which is best? I'm going to maintain a position close to my knees. I'm going to maintain vertical pressure on the client's chest. Recheck after, or I'm going to check for return of client's pulse every 8 minutes. Maintain position of the client. Well, yes, I want to close this. Why my knees need to be. Maintain vertical pressure after our client's chest to the heel. In the center of their chest, right on their sternum, and I'm going to recheck my questions. Well, I don't remember anything. That that that's something you're not supposed to do. I'm reading one, and again, I'm using critical thinking. So there would be, I'm going to maintain pressure. That would be the best correct answer to choose from. This category will be safety and infection control. So here's your question. The physician orders tobramycin sulfate 3 milligrams per kilogram IV every 8 hours for a 3-year-old boy. You, the nurse, enters the client's room to administer the medication and discover that the boy does not have an ID bracelet. Which of the following should you do? So out of all these possible responses, which is the best? Which is the best one? Ask the parents at the child bedside to state their child's name. Number 2, ask the child to say his first and last name. Number 3, have a coworker identify the child before giving the med. And number 4, hold the med until an identification bracelet can be obtained. So if you could only do one thing out of these 4, which one would you do? So let's look down through them. Number 1, ask the parents at the child's bedside to state the child's name. That seems like a good option to me, right? 3-year-old kid. Parents are right there. They are the child's guardian. So that could be a good option. Number 2, ask the child to say his first and last name. Well, that's an option too, but remember, this is a 3-year-old boy. The information that you receive may or may not be reliable. So that may not be your best option. Number 3, have a coworker identify the child before giving the med. Okay, so who is a coworker? Are we talking about the janitor here, the receptionist? Who are we talking about? So that is way too vague of an answer. And not only that, it's not germane to the situation. Why would I ask a coworker about the med? So I am in charge of this child. This child is my patient. So that answer would go out the window. Number 4, hold the med until an identification bracelet can be obtained. That's a possible option as well. We're looking for the best right answer right here, the best one. If I could only do one thing, which would I do? So I'm down to basically 1 and 4. Ask the parents or hold the med. Now, holding the med is never a good idea, especially if you don't have a physician's order to hold the med. Nurses, that is outside our scope of practice to say I'm holding this med, unless there's an untoward outcome happening. If something is emergent, but this doesn't bring that in, again, that's reading into the question. So me thinking about this, I'm thinking that between, I would choose number 1. The parents are right there. They are the child's guardian. Can you please tell me your child's first and last name for the sake of medication administration? All right, our next will be the reduction of risk potential category. So here we have a 7-year-old girl with type 1 diabetes. She's been home for several days is brought to the emergency department by her parents. If the child is experiencing ketoacidosis, the nurse would expect to see which of the following lab results. So reading through this question, pretty much the entire intro into that question is non-essential information. The fact that it's a girl, 7 years old, that doesn't matter. Type 1 diabetes, that matters, but I'm not looking for any of that. That's information that is obviously apparent by the fact that the child may be experiencing ketoacidosis. So if the child is, it's a big if, the child is experiencing ketoacidosis, I would expect to see which of the following lab results. So the direction I'm going is I'm looking for which lab result will prove to me that ketoacidosis is happening. Number one, a serum glucose of 140 milligrams per deciliter. Number two, serum creatinine of 5.2. Number three, blood pH of 7.28. And number four, hematocrit of 38%. So I am leaning into my clinical judgment, critical thinking skills here, and I'm thinking about this. Number one, serum glucose 140 milligrams. I know that's over the range. If you know your range, 70 to 100, it's over, but it's not over by much. So I'm not concerned at all about that. When you do hit the floor and you start understanding what is acceptable and acceptable ranges for diabetics, you will know that 140 is not a bad range at all. Serum creatinine of 5.2. Why is creatinine germane? I'm looking for ketoacidosis. And the way that is discovered is through the urine. They're spilling glucose into the urine. So I'm looking for ketoacidosis. So acidosis is directly related to what? pH level. Number three, blood pH of 7.28. And then number four, hematocrit of 38%. Ketoacidosis has no impact on hematocrit whatsoever. So to me, this is pretty, and the answer is blood pH of 7.28. Blood is acidic. Okay, 7.28. If you know your pH levels, and you've got to know your levels, you've got to know these kind of levels. You need to know your electrolytes, you need to know your lab values. Those are crucial. So please make sure you know those. Our next category is safety and infection control. And here is our question. After receiving a report from the night nurse, which of the following patients, should the nurse see first? So priority, which of these do I need to see first? Number one, a 31-year-old woman refusing sucralfate before breakfast. Number two, a 40-year-old man with left-sided weakness asking for assistance to go to the bathroom. Number three, a 52-year-old woman complaining of chills who is scheduled for a cholecystostomy. And number four, a 65-year-old man with an NG tube who has had a bowel resection yesterday. So if I could only do one thing, if I could only see one patient, which patient would I go to see? So I got a 31-year-old woman who's refusing to take her pancreatic med before eating breakfast, which is gonna, if she refuses to take it, it's gonna result in probably some pretty good heartburn, some stomach cramps, but it's not gonna be an emergent situation. So that's not super important to me. And again, you got to know your meds. If you don't know what that med is, then you're gonna have a hard time knowing if it's important or not to take it. Number two, a 40-year-old man with left-sided weakness asking for assistance to the commode. Well, left-sided weakness, that's a priority, but if it was the only thing I could do, would it be the thing I would do? Is this something that I could delegate? Yes, it is. I definitely delegate this. It's not an emergency situation. It's not acute. It didn't just come out of nowhere or anywhere. So yeah, I can go ahead and delegate that. Number three, a 52-year-old woman complaining of chills who is scheduled for gallbladder removal. So if you've ever had an operation or ever worked in an area where the operations are performed, surgery is performed, you know that if the patient is complaining of any kind of malaise the day before, days before the day of surgery, that surgery is postponed. So she's complaining of chills, could be that she's just cold, but she's complaining of chills, but she's scheduled for major invasive surgery. And then I have a 65-year-old man with an NG tube who had a bowel resection yesterday. If you know anything about bowel resections, an NG tube is standard practice. Why? Because we need to rest the digestive system. We don't want any peristalsis going on because we've removed part of the colon and then stitched those intestines back together, and we want that to heal. Therefore, we don't want any peristalsis to happen because that would cause movement, which could cause those sutures to break. So out of all of these, the one that I need to pay the most attention to would be a 52-year-old woman complaining of chills who is scheduled for gallbladder removal. So remember that we're priority questions. We're looking for the answer. If I don't take action, something very bad will happen or could happen. So this is one of those questions. All right, then we go into psychosocial. So here is a sample psychosocial question. You have a 50-year-old male client. He arrives at the nurse's station and asks the nurse if he can go to the cafeteria to get something to eat. When told that his privileges do not include visiting the caf, the client becomes verbally abusive. Which of the following approaches by the nurse would be most effective? Now be careful of these kind of questions because some of them ask it in the positive, some ask in the negative. This one is the positive, most effective. They could replace that word, the test writers could replace that word with least. So make sure you're reading the question very well, super important. So here are your possible answers. Tell the client to lower his voice because he is disturbing the other clients. Number 2, ask the client what he wants from the cafeteria and have it delivered to his room. Number 3, calmly but firmly escort the client back to his room. Or number 4, assign the nursing assistant personnel, NAP, to accompany the client to the cafeteria. All right, when I'm looking over these answers, again, if I want to look for the best answer, I can do one thing. What's the one thing I'm going to do? Number 1, tell the client to lower his voice because he's disturbing the other clients. Well, that is totally blame shifting. So please lower your voice, not because, now look back to the question. The client doesn't say anything here about the client raising their voice, number 1. Number 2, the client becomes verbally abusive. Now, you can be verbally abusive without raising your voice. You can use choice words, insults, whatever, without yelling. So nothing in the question says that the client raised their voice. So that answer is out immediately. Not only that, like I said, it's a blame shift. I'm not saying, hey, stop abusing me. I'm saying, I don't like what you're doing because it's bothering the other patients. So that's not a good answer. Excuse me. Number 2, ask the client what he wants from the cafeteria and have it delivered to his room. Well, this is throwing yourself under the bus because you've already said to the patient that his privileges do not include visiting the cafeteria. So you've already established the hospital's policy. The hospital's policy is, sorry, but you don't go to the caf. You're admitted to this unit. Your dinner will be brought to you, right? We don't need you dragging your IV pole down to the caf or whatever. So not a great answer because again, it is a blame shift to somebody else. Number 3, calmly but firmly escort the client back to his room. That's a really good option. Number 4, assign the nursing assistant personnel to accompany the client to the caf. Again, a blame shift. I'm not going to deal with it. I'm going to give it to the NAP and let them deal with it. So that's a really bad answer. To the correct answer, which is you tell the patient, you know what, why don't you take a walk with me and you bring them, and remember, firmly back to their room. You're going to go back to your room, and when we get back to your room, we're going to have a little talk about civility and how the hospital expectations of patient behavior while they're hospitalized. Remember, when you're an RN, you don't surrender your rights to the patient. You don't become antagonistic towards your patients. But there were several circumstances I found myself in as a nurse where I needed to establish my authority in that I was an RN, I work for the hospital, you are a patient here. Basically, you are a guest, and I used that word with patients before. You are a guest in our facility, and we do have rules and regulations that employees and patients are expected to abide by. And that is a conversation you could have after the fact, but this is the correct answer. You calmly and firmly escort them back to their room. Okay, basic care and comfort. So here you have a 9-month-old girl that has had a cast applied for the treatment of talipes equinovarus, Which of the following instructions is most essential for the nurse to give to the child's mother regarding her care? So here we have a 9-month-old girl, so very young, has had treatment for talipes equinovarus, excuse me, struggling with that word. Now, even if you don't know what that is, you are giving discharge instructions to the child's mother regarding her care. So let's lean in on our answers to see which one makes the most sense. Offer appropriate toys for her age. Would you make that part of your discharge instructions? Number 2, make frequent clinic visits for cash adjustment. Number 3, provide an analgesic as needed, or do circulatory checks of the casted extremity. Now, nothing in the question related to a cast or an extremity, except for the name of what was done, okay, the treatment they were given, talipes equinovarus. Okay, now if you don't know what that is, then you're going to have to lean into your answers to lead you in the right direction. Now, number 1, offer appropriate toys for her age. Well, I think the girl's mom probably already knows how to do that. I have no idea why I would make that part of the discharge planning. So I'm not going to lean that direction at all. Number 2, make frequent clinic visits for cast adjustment. Well, define frequent. This answer is far too general. It's far too vague for discharge. What is frequent clinic visits? Is that once a day, twice a day, 3 times a day, once a week, twice a week? And cast adjustment, why would I be needing to adjust the cast that often? It's too vague of an answer, so I'm not going to go that way. Number 3, provide an analgesic as needed. It's important, but as needed is again, very vague. And a 9-month-old, how are you going to know when it's needed? And we're trying to stay ahead of the pain, so I'm not going to go that direction either, which brings me down to do circulatory checks of the casted extremity. Now, that is something that we would do because there's something called compartment syndrome that if you haven't learned about it yet, you will learn about. That when a patient has a cast, we always check the extremity to make sure that it is warm, that is well perfused, because if it's cold and turning blue, that means that we've got something called compartment syndrome going on, which is bad. So, and this is for treatment of club foot, by the way. So the correct answer would number 4, do circulatory checks of the casted extremity. All right, next up, health promotion and maintenance. So here, the nurse is assessing the best approach to prepare 3 clients for surgery. Each client has a different learning preference. Match the learning preference to the appropriate approach. All options must be used. So here's a matching, and here are my options. Number 1, brochures about preparation activities. Number 2, models of the relevant anatomy. Number 3, discussions about surgery. So my types of learners are auditory, visual, and tactile, or kinesthetic. All right, so those are my options. So how am I going to match these up? Brochures about preparations for activities. Brochures are something that you look at. So which of those answers aligns with that? Well, that would be B, visual. 2, models of relevant anatomy. Models, something that you touch, that you can manipulate. And manipulation, touching is tactile. So that would be the answer for number 2. Discussions about surgery, discussions, you speak and someone speaks, you hear them. So that would be auditory. So our answers are number 1 would be B, number 2 would be C, and number 3 would be A. So let's tie this all together. To this point, this is what we have gone over. So we've got critical thinking and or clinical judgment. And going through your courses here at Nightingale, you have your Elsevier adaptive quizzes, the EAQs. These are adaptive quizzes in nature. They are much like the NCLEX, meaning that when you answer a question correctly, the computer will then give you a harder question. If you answer that question correctly, it will then give you another harder question and so forth. Conversely, if you answer a question incorrectly, the computer will give you an easier or lower difficulty question. This is identical to the NCLEX. Remember, it's not going to feed those to you immediately. It will wait and then give you another question. And keep this in mind as well. If we're using Benner's model, novice to expert, nurse, keep in mind that when you sit for the NCLEX, you, as far as your level, if you will, you are not yet an RN, and you are not even at the novice level because you're not technically an RN yet. Now, I don't say that to speak down to you. It is just factual. So, and the reason I say that is you are not going to get questions above the novice level. Okay, they're going to be novice level or below because you're not even there yet. You're not an RN yet. The NCLEX is testing to make sure that you're going to be safe. So when you go into the NCLEX, don't be thinking that you're going to get these questions that an expert nurse would be able to answer because you're not there. You're at the not at or below the novice level. So those are the kinds of questions that you're going to be seeing. The expectation is that a novice level nurse should know this information. You're also going to be, through your time here at Nightingale, either you have or you will do computer-based sims. These are provided to help you learn to critically think to a deeper level. The nurse was, you must, as the nurse, you must always be asking yourself the question, why? Everything is interconnected, and your job as a nurse is to be able to connect the dots. So the graphic here is several students with an instructor working in a sim lab on a patient. And this is, we have a patient who presents this way, and you're looking beyond what you see. You have a situation that presents itself, and you're looking to think to yourself, why? Why is the patient presenting this way? Why are they short of breath? I can see they're short of breath. I can see they're cyanotic. Why? And you keep asking that question, why, until you arrive at the answer. So that is what clinical judgment and or critical thinking is. The ability to ask that question, why, and work backwards until you arrive at the answer. It's connecting the dots. Okay, that is heart of critical thinking. In both these cases, the ability to understand what critical thinking is and then knowing how to apply it in a given situation is crucial to your success as a nurse. So the last thing is lots and lots of hard work on your part. I've said this before, I will say it again. I say this to my previous learners I worked with. I used to say this to precepting students. You need to eat, drink, sleep, breathe, and live nursing if you want to be successful. You have got to make it your highest priority until you graduate, sit for the NCLEX and pass. It's all consuming, and it's to that level. And if you're willing to do that, you will find success. I guarantee it. You will find success. All right. Keep this in mind at all times. The most important thing to remember about the NCLEX questions is that they are framed in such a way that assumes you have everything you need to do your job correctly. I mentioned this before, just to touch on it again. If you find yourself thinking, well, in my facility, we do it this way, or yeah, what about this? Yabbats, I call those the yabbats, and yabbats live in the woods. So those are known as reading into the question. They should be a huge red flag that you're on the wrong track immediately. So if you find yourself reading into the question, what about this and what about that, then you are on the wrong track. Stop that. Stop yourself and get yourself back on track. Writers of the NCLEX questions who are nurses, they know how things go on the floor, and they will put those in their answers, not to try to trick you, but to try to make sure that you're paying attention. Only textbooks practice, let me read that again, only textbooks practice enters the NCLEX. So facts may seem to contradict or differ from what they would be in real life. So keep that in mind. The way you do things on the floor If you're currently working in a hospital, the way things go on the floor is not the way they go with the NCLEX, because the NCLEX is written on textbook principles. Okay. You must guard against bias from clinical experience. So in other words, take your clinical experience and check it at the door. You've got to guard against that in order to promote your best performance on the NCLEX. You can't argue with the NCLEX. Well, you can. So I want to wrap up by addressing some things you can do to address test taking anxiety. Um, all of the NCLEX coaches, myself, Professor Smith, and Professor Thompson, we will cover this at the end of every session that we go over with you all, so that you can have these things and maybe, put them in your little bag of tricks. These are things you can lean in on to help you address anxiety. And remember this as well. Sitting for a test is not, it's not the end of the world. It's not to that level. It is a test. I know there's a lot riding on it. I've been where you are, but please don't let it rise to the level where you think, if I don't do well on this, my entire life is just going to collapse. It's not that level. So, catastrophic thinking will sink you. Don't do that to yourself. So I am big into practical things you can do to help yourself. So here are some very practical things you can do to help yourself out. Make sure you're eating the day of the test. Get something to eat. Your body needs fuel to run on. If you're not fueling it, you're not going to be in your right mind. There's all these studies about kids coming to school, not having had breakfast, which is why we have all these school breakfast programs now. Make sure, and the same applies to adults, make sure you're eating, okay? You may not feel like it. Your stomach may be all tied up in knots. Eat something anyway. Do your best to keep yourself fed. On the same lines, make sure you're drinking fluids, and hopefully the kind of fluids that won't alter your mental state. Okay, so drink, stay hydrated. Gatorade, Powerade, juice. Don't get jacked up on power drinks, energy drinks, Mountain Dew, drinks that have lots and lots of caffeine content. Don't do that to yourself. Then you just get the jitters and you'll be a mess. Make sure you're well rested. Okay. The day of the test, make sure you're well rested. Don't stay up all night the night before cramming. If you've waited that long to engage, chances of you doing well are very slim. Okay, don't do that to yourself. Make sure that you've done everything you can do coming in, and then just rest on what you've done. Be confident in the fact that you have prepared for the test. Relax. As I said before, this is not the end of the world. At the end of the day, it is just a test. There may be a lot riding on it. I get that, but it is just a test. Check in with your body. It's important. Are you all tight? Is everything tight? And I used to tell my precepting students and other learners that I've worked with, start at one of your extremities, either your hands or your feet or at the top of your head. I like starting at the top of my head. Check your forehead. Is it all furrowed up? Is it all crinkled up? Is your face, is your mouth all tight? Do you have your lips all tight? Relax those things. Move down to your shoulder, your neck. Is your neck all stiff? Are your shoulders all tight? Are your shoulders up? Um, Relax those. Go down your arms to your hands. Are your hands all fisted up? Are they all, just open them up, stretch out your hands, stretch out your arms, then move down into your torso. What's your breathing like? Are you rapid fire breathing? Take some deep breaths. Move on down. Your legs, they're all tight? Are your toes all curled up in your shoes? There is a technique called crossing that you cross your arms, you cross your legs, and you just take deep breaths. They call it getting crossed up, which can help you relax. So very practical things you can help yourself do to stay calm. Take breaks. While I remember when I was in school, nursing school, our tests were paper tests. Every now and again, I'd put my pencil down on the table and I would focus on something clear across the room. I would take deep breaths, just try to get myself recentered. Give yourself a break, okay? Take your hand off the mouse, take your hands off the keyboard, put your hands flat on the table, put your feet flat on the floor, and focus on something else for 10, 15, 20 seconds. Just give yourself a little break. Stretch. Nothing feels better than a good stretch. So again, during the test, if you just need to take a minute and stretch yourself out, put your hands up over your head, then do it if it will help address your anxiety. Focus. This is huge. Focus on the task at hand. Don't focus on how many questions you've answered. Don't focus on how many more questions are coming. Focus on the task in front of you. When you are reading that question, give it your full attention. Read the question, read it well, read the answers, read them well, and then answer the question. Answer the question and move on to the next one. Don't get hung up on that question. Answer it and move on. Music is a really, really excellent tool that you can use to help address your anxiety. When I was studying for tests, I would put my headphones on. I listened to music that had no lyrics. It was just instrumental music, and it would really help address my anxiety. While you're testing from home, if you can have music running in the background that isn't loud enough that it's going to make the preceptor or the proctor come on and ask you to turn it down or turn it off, you can do that as well. And finally, nothing will beat preparation. Or it's not quite finally, but nothing beats good preparation. If you are waiting, as I mentioned earlier, if you're waiting to the day of the test to prepare, chances of you doing well are slim to none. So engage, prepare, go over this stuff, go over your PowerPoints. I used to record all my lectures. Anytime I was in a didactic lecture, I have a micro recorder that I keep on my desk. I still have it. And I would record all my lectures and I would listen to them over and over and over. And I would have my PowerPoints at the same time and notes I had taken, and I would go over those as well. But I would listen to that and prepare. And finally, when you have done everything you can do, stand. When you answer a question, stand on it. Don't change your answers. It's next to not preparing. It's probably the worst thing you can do. Change your answers. Don't change your answers. You pick an answer, you stand on it, you move along to the next question. Forget about that question. Answer it, move on, stand on it. And that's going to wrap up this PowerPoint presentation. I hope it's been useful. If you have any questions at all, please feel free to contact me. My name is Professor Tom Hazel. My email address is right here. Looking at the screen to my right would be Professor Shauna Smith, and her email address is right there. Or you could reach out to Professor Jody Thompson. She's down on the bottom row, and her email address is there. Feel free anytime you have questions. If you'd like to schedule some time to meet with us, we'd be happy to set up a Teams meeting with you because we really do want you to be successful. And that's going to wrap it up. Thank you so much. I hope to see you again very soon.